Okay, hi everyone. Thanks for joining me today. Today I get to talk about one of my very favorite subjects, and that is the case studies or the testimonials or the private patient experiences at Recovery Solutions. I was just thinking about doing this, and I get really emotional because we have some incredible success stories. And so I have to choose out of all the success stories, like which one am I going to talk about, right? Of course, for confidentiality and HIPAA privacy, I'm not going to talk about their names, and I'm going to try to uh, not talk too specifically so that way I adhere to their privacy. But I do want to let you know that we do have some incredible success stories, and there's some common characteristics of all of those. Some of the things that I was talking to my colleague about last night is that here's some of the common characteristics that each of these participants that I'm going to talk about have in common. One is that they came to Recovery Solutions, and Recovery Solutions provides personal, customized care for our patients and our families. And I think it's that customized care that makes really a huge difference in their lives. And what do I mean by that? You know, we provide really individualized care. Our patients get a lot of attention because of the size of our facility. We're very family focused. So not only is the participant our patient, but the family is also a client of ours. So we're taking care of the family needs, and all of the participants that I'm going to talk about, the success stories that I'm going to talk about, each one of them had some in-depth family work at our facility. So that way we could prepare the families to really be the best support for our participants. So that way they could have not only successful treatment, but successful recovery. Uh, the other is that each of the participants decided to stay in our local area where they were attending 12 step fellowships, where they were making social connections, and where they really started to develop their recovery identity, both at Recovery Solutions and within the recovery community. Those are some of the things that I could see that they all have in common. And the other is that they all came in very hopeless, desperate, and did not believe in their self, did not believe in going to 12-step programs, did not really believe in treatment, didn't want families really involved in their treatment. So all of those things were the initial reactions of the participants. But as we developed rapport, as we educated them on the importance of all of those things, they started to incorporate those things into their treatment and their recovery life. First one I'm going to talk about, it was individual who came in for outpatient. They wanted to see me individually because they were having some pretty significant problems with anxiety, and they had previously put down alcohol and started to go to the doctor, and the doctors did what doctors do, and they gave him medications. And then this individual was not able to manage the medications that the doctor had been prescribing, and then they found themselves in a lot of trouble with the medications and overtaking the medications. And we immediately started doing some family work with this particular participant, and the whole family became involved in this participant's treatment experience. This particular patient was with us for, I believe, duration of inpatient 90 days, possibly going into 120 days. They just needed that much support and that much time to be away from all of those life triggers that were causing a great amount of anxiety for them. And they were able to really develop some really good um, coping skills, develop a really strong recovery support system, reintegrate into their family experience and start to participate in family functions again. At this particular time, this person is actively back to work. They live in their own home and they're actively participating in their 12-step fellowship meetings and functions. So I would say an incredible success story. Family is really supportive and happy with their loved one, and also very supportive and happy with the services they were able to be provided through Recovery Solutions. Next individual, female patient, came just really withdrawn. They were able still to be working and trying to mask their substance use disorder, mask their depressive disorder, uh, had been separated from the family and living really a secret life for a long time. But the indicators were all there that there was a problem, but nobody really knew what to do with them. And this particular individual happened to reach out for help themselves. They were just sick and tired. The job really was the motivator that said, hey, we're all really realizing that there's a problem here. You need to go get some help. And their job was really supportive of their ability to come to treatment. And we worked with their job to let them know, throughout the course of this individual's treatment, how things were going, and that the plan was for this particular participant to be able to be healthy enough to return, and they were supportive of that. So thank goodness the employer was supportive of the treatment episode. But at Recovery Solutions, we work with employers, and it often works out. Once we get involved, the participant sometimes gets concerned, if they're going to be able to go back to their job, that they can't leave their job. So we're really effective at working with the Human Resources Department and their employers to get the employer to understand the importance of supporting our participants and keeping that job available and that position open for that participant once they are healthy enough to return. And in this case, it did work out like that. Again, some really incredible family work was done with this participant. This participant had no previous treatment experience whatsoever. They did exceptional throughout the course of their treatment. They too were a participant that stayed inpatient, I think maybe 60 days, and continued on even after leaving the inpatient portion of their treatment, and continued to come back and forth while they were working and return to their family, return to the home, return to work. They continued to come for a brief period of time until they felt stable enough, until they felt that their 12-step fellowship program would be able to be enough for them. So we encouraged them to stay with us and then attend their 12-step fellowships. And again, a lot of success there. Individual is effectively back to work. I think she might have even bought her own home, started having her daughter live with her full time, have a really good relationship with her employer, and really very good relationship with the family. So success story number 2, and what a blessing it is, to be able to do what we do at Recovery Solutions, to be able to bring these families back together and heal some really deep emotional and spiritual, in some cases, wounds. The last one that I'll talk about, and I could go on, and on about our success stories, and that, like I said, I love doing that. But for the sake of being brief, I'll talk about this last participant today. I'll call this participant PD, even though that's not this person's name. But this particular person was with us for a short period of time and refused to do the supportive housing, wanted to determine their own course of treatment. And we tried to do the best that we could with this person. And I think the best thing that we did do was provide a safe environment and safety with our therapist and develop a really strong relationship, so that way when this participant was ready, that they knew that Recovery Solutions existed, that it was a safe place for them, that they found a lot of support from our staff and from the therapist here. So a couple of attempts were made on this participant's part. They just couldn't grasp, never using drugs or alcohol again. And so they had to stumble around a little bit, but they would stay in touch. And of course, we always had open arms and were very encouraging and just said, we're here when you're ready. And when the floor fell out from underneath this person, they ended up going to a few psychiatric facilities because of the damage being done as a result of the substances used. And the mental health facilities thought that he possibly could have a psychiatric disorder that's severe and that he may not return from. However, at Recovery Solutions, we're very familiar with the psychotic features that are induced as a result of these substances, especially when you mix a lot of substances together. So we took a chance on him and we brought him back, and this particular person had some psychotic features when they came, and our psychiatrist was really able to get in there and do the work and diagnose and put the appropriate medications. We had to try a couple, but we just surrounded him with some caring staff, some highly qualified professionals, and just continued to encourage this participant to stay the course, that you are getting better, you will get better. And I want to tell you, this particular individual needed a very long-term care. So 30 days was not going to do it. As much as we would like people to get well in a short period of time, the reality is that everyone is individualized, and this particular individual was with us for a number of months, and we just kept providing educational experience, recovery, supportive, safe environment. Had huge anxiety disorder, depressive disorder, substance use disorder, a lot of things going on together. So today, this individual is driving their own car, living on their own, going back to work, and again, some really strong relationships with family. So those are some of our success stories. Thanks for being with me today, and have a great rest of your day.